I had been suffering from acid reflux for, I think, about a couple of 2 or 3 years.
2 or 3 years.
The culprit was sour cream.
Mm-hmm.
And in fact, when I had that terrible occasion down there in Washington, D.C. at my granddaughter's college graduation, there was a big baked potato and I couldn't resist putting sour cream in. I erupted and I really kind of spoiled dinner. And it happened several times. And then I went to my general practitioner here and he referred me to Dr. Esophgael. And then Dr. Esophgael said, well, we're going to go down and look and see what's going on down there. And he said, well, you have Barrett's disease. And he said he wanted to look one more time because he saw some areas that he was concerned about. And they did a biopsy, and that's when they said, well, you have level 2 cancer. Yes, very quite shortly after that, right. And then I started going through the halo procedure. I guess they just take a very thin layer off, so if it's a little deeper, they don't always get it the first time. But so he touched it up again, and I was fine. And I went in 6 months, and I was clean. I went in 6 months again. He says, there's a little spot. So they gave me the treatment again. And since then, I've been clean. It's anywhere from 1.5 to 2 years ago now. Story, I remember about 2 years ago, I told one of the nurses I was a guinea pig for this procedure, and she said, no, they did the pigs first. So the first was removal of the esophagus, which to me sounded rather drastic. You know, it just sounded like I've been under the operation table before, and that sounded like it would be a big one. The second one, he said, was with laser, and he said, sometimes we don't get it all, we don't get all the spots, and sometimes we burn a hole through the esophagus, and then we have other problems. And then he went into the new procedure that he had developed called the halo, and he described it to me. And I said, that sounds pretty good. No, as soon as he described all three, that was the end of the discussion. He gave me a box of pain pills, and I had a little scratchy throat. And I took the pills for 2 days, and it didn't get worse or better, so I said, I just stopped taking them. And nothing changed. A few days later, the scratch was gone, and that was the only discomfort I had. It was very minor. I think it's the nature of the beast. I don't know. I figure there's no sense in worrying about it. And it has been, like I say, painless. It has, you know, I don't feel like it's really an intrusion. And I can live with it. I think, interestingly, when I come out of the anesthesia, I guess I'm talking a blue streak, and I don't remember that for about the next hour. If you get acid reflux, I think it's something you should look into. But yeah, at least other things. I mean, since then, I've been told more than once, yeah, the Barrett's disease very frequently leads to cancer. And so don't mess with it. You know, I mean, it's sure you can take your pills and so forth, but it's something, it's a sign that there's something wrong. You think about it, 5 years ago, this procedure didn't even exist, and I would have had choices of 1 or 2. And I asked him about, well, do I have to be operated on? And he said, very definitely, because it will get worse. As far as the halo part and this Barrett's disease, I would recommend it to anybody because my experience has been very good. It's painless, and it seems like it works very well. Like I told you before, I don't even think about throat cancer I mean, I don't wake up at night thinking about it. So, great. So I know in my own mind, sometime down the road, something is going to take me. I feel very confident that it will not be throat cancer. I don't even think about it.